Welcome to Registered Nurses Empire. There are 10 practice questions. You have 10 seconds to answer and check rationalization. Good luck. Question number 1. The nurse manager is instructing staff nurses in a unit. Which statement is best to include when delegating the responsibility for reviewing the educational policies of the unit? 1. Tell me what you think after looking at everything. 2. Give me your suggestions and I'll decide. 3. Complete the task in 6 weeks. 4. Let me know if you need anything. The answer is 4. Let me know if you need anything. Remember that the delegation must be clearly and precisely conducted. The nurse manager must assign responsibility, define the task to be accomplished, clarify what results are required, and define the time frame for the work to be completed. Question number 2. To reduce the incidence of central IV line infection, the nurse manager implements new procedures in the unit. What best indicates that the measures have led to an improvement in results? 1. A comparison of total IV antibiotics used between the 2 time periods shows a drop in antibiotic use. 2. Retrospective chart audits for infection rated show improvement in client with central IV lines. 3. A decrease in the total number of central IV line infections in the units is identified. 4. A survey of the unit's nurses indicates perceived improvement in results. The answer is 2. Retrospective chart audits for infection rated show improvement in client with central IV lines. In the affected population, compare outcomes. Opinions are helpful, but they do not carry the same weight as practice based on evidence. Question number 3. A 6-year-old client with autism spectrum disorder is hospitalized due to an accident in the playground. Which action should the nurse implement? 1. Encourage the patient to verbalize his feelings. 2. Assist the patient to go back to the playground. 3. Advise the parents of the client to give a routine activity. 4. Let the patient rest for a while to avoid trauma. The answer is 3. Advise the parents of the client to give a routine activity. Remember that autism spectrum disorder is a neurocognitive disorder that affects interpersonal skills, judgment, and developmental milestones. Consistency is the best management for this case. Question number 4. When educating the parents of a 17-year-old female adolescent who has been diagnosed with depression, which of the following information should the nurse include? 1. Patients with this condition usually undergo series of drug therapy. 2. The best treatment for your daughter is electroconvulsive therapy. 3. Your daughter's condition will need environmental therapy. I think it is much more beneficial than medications. 4. Depression doesn't need any therapy at all. Talk to your daughter frequently so that she can verbalize her feelings. The answer is 1. Patients with this condition usually undergo series of drug therapy. Remember that drugs involved when taking care of the patient with depression are the following: tricyclic antidepressants, selective serotonin reuptake inhibitor, SSRI, monoamine oxidase inhibitors, MAOIs. Question number 5. A nursing student asks the instructor about appropriate nursing care delivery systems. Which of the following would be best for the instructor to provide as an example? 1. Primary nursing in a rehabilitation unit. 2. Functional nursing when most registered nursing staff cannot report to duty. 3. Team nursing in the intensive care unit. 4. Case management in the emergency department. The answer is 2. Functional nursing, when most registered nursing staff cannot report to duty. Remember that, during this crisis, functional nursing best utilizes the abilities of all employees promptly. This delivery system requires those who can best perform them to have the least staff and delegate tasks. Question number 6. Which of the following models of care may you suggest for patients with Alzheimer's disease? 1. Environmental modification therapy. 2. Group therapy. 3. Behavioral therapy. 4. Cognitive behavioral therapy. The answer is 4. Cognitive behavioral therapy. Remember that this therapy focuses on reconnecting or aligning thoughts to the behavior. Question number 7. As the nurse is turning off the lights in the psych ward, a client with manic disorder says, "I want to play video games. I am not yet tired and sleepy. Once I finished what I am playing, I will sleep immediately." Which of the following statements should the nurse reply to the patient? 1. Okay, but make sure you turn the television properly. 2. I can play with you if you want. 3. Rules are rules. 4. Everyone here in this facility should sleep by around 9 p.m. The answer is 4. Everyone here in this facility should sleep by around 9 p.m. Remember that the patient is trying to manipulate the nurse. The best approach for this scenario is to set a limit in a matter-of-fact approach. Question number 8. During the orientation phase, a male patient with a mood disorder is concerned about his life, and when will he die? Which of the following response by the nurse shows therapeutic? 1. Someday you will know when is the right time. 2. I understand how you feel. You may ask your doctor about the severity of your case. 3. You were saying that you're going to die. I am sorry to hear. 4. Tell me more about your insights of death. The answer is 4. Tell me more about your insights of death. Remember that the nurse is showing an example of open-ended question and exploration. Question number 9. The patient is suffering from a panic disorder. Which manifestation is cause for greatest concern? 1. Patient is experiencing chills. 2. Patient is having feeling of chest tightness. 3. Patient is verbalizing tingling sensation. 4. Patient is increasing the pacing of his movements. The answer is 2. Patient is having feeling of chest tightness. Remember that, although all of them are manifestations of panic attack, chest pain should be the priority to attend because it can lead to airway problem. Question number 10. The nurse in the emergency department is responsible for the triage of clients from a major catastrophe. Which of the following 4 clients should receive priority in care? 1. A female client who is 2 months pregnant with a partial thickness burn on forearm. 2. A child who has a 3-inch oozing laceration on the leg. 3. A client whose forearm is disfigured with protruding bone and a finger capillary refill of 2 seconds. 4. A client with a large shard of glass piercing the chest wall, whose respirations are 32 breaths per minute. The answer is 4. A client with a large shard of glass piercing the chest wall, whose respirations are 32 breaths per minute. Remember, the integrity of the client's chest wall has been compromised, and this has become an issue of breathing. The other clients can wait for up to 2 hours. How many scores you got out of 10 practice questions, nurse?